All right, good afternoon. My name is Nikki Gray. I'm the Executive Director of the Community Health Council in Lebanon County. And part of the Community Health Council is the Coalition to End Homelessness. And so I brought with me the two chairs from the Coalition to End Homelessness.
So Brian Smith with Coalition to End Homelessness as a co-chair.
And Jolynn Foltz, co-chair of the Coalition to End Homelessness.
And I'm Sean Gamble from Congressman Muter's office. I also sit on the Homeless Coalition as well.
So what I wanted to start with today was a little bit of history about the requests that we have. I know this is a workshop today, so one of the things we wanted to discuss is the housing study, a comprehensive market analysis of the county. Joellen, if you'll remember, a little over 2 years ago, we did discuss this. It never got very far because COVID, and then a lot of things happened, including the 2020 census, which would make a difference in the data that we collect in this study. So it was prudent to wait, and that's why we did not pursue it during COVID. So Bob might recall hearing about this also in 2020. But what I did want to go way back and discuss the origins of a request for a comprehensive market analysis of the county. This request actually dates back to 2013. When the group called LHOT at the time, which was the Local Housing Options Team, started or created a Lebanon County Housing Advisory Panel, and they met, and their number one priority in 2013 was to request Act 137 money from the county to complete a comprehensive housing study. I don't have information about why that request didn't happen in 2013, but fast forward a number of years to 2019, and that's when the Local Housing Options Team started to meet again and wanted to place this request at that time. At that time in 2019, we did write an RFI, and we solicited a couple of companies nationally who do comprehensive market analyses, and we did have meetings with the commissioners at that time. It never got beyond those meetings, again, because of COVID. So where we are today, really, is, of course, we're post a pandemic. We have a comprehensive plan for the county that was written in 2007, so 15 years old. And that data in the housing section of the comprehensive plan is based on a data set from 1995 to 2004. So there, to my knowledge, has not been an update of that housing data in the county since the 2007 comprehensive plan. So during our conversations last year, when the Lebanon County Economic Recovery Group got together to meet, led by Susan Eberly and a bunch of other county stakeholders, we did discuss that a priority coming out of the Lebanon County Economic Recovery Plan would be a housing study. There is currently funding available, hopefully from multiple sources, and we've got a lot of interested partners who find this data that would come out of this study very valuable. So that's why I'm here today to really talk to you guys about what your thoughts are around partially funding a housing study. I did apply to the city for some funding for the same study. So hoping to use ARPA funds from the city to partially finance this
Did we
study.
give you money before?
No, we never got to deciding where that money would come from or even exactly how much we would need.
Do you have estimates?
I do have some estimates, yes. The estimates range from $35,000 to about $55,000. Once I get a commitment, I would like to release an RFP that would be written with the stakeholders who are invested in the study, and then put the RFP out to the people who have responded to the RFI for a very accurate proposal. Mm-hmm. Yeah. So I have some other things, I was going to talk a little bit about the 2007 comprehensive plan and some of the things that are noted in that plan. I think the most important thing is that the comprehensive plan goes to 2020, and we have no projections for housing beyond 2020 based on that plan. There is a notation in the comprehensive plan around the how much a family of four, coming out of poverty might need to subsist on. In that time at 2007, it was 39,855. We know now, based on new United Way Alice data, that number has increased to 47,000. So we just have so much. We have so many new needs in the county in regard to affordable housing, and that's why we would like to ask for this study.
Nikki, if I may.
Sure.
When we did that comprehensive plan, I was here.
Yeah.
And I seem to recall that DCNR, PennDOT, and other state agencies helped to fund the whole comprehensive plan.
Mm-hmm.
And if that data ended 2020, and the state has ARPA funds right now, did you talk to planning to see if they are interested, if the state has expressed interest in doing the full comprehensive plan so we don't duplicate efforts?
Well, interestingly, the comprehensive plan would not duplicate a comprehensive market analysis. The comprehensive plan would be based on the data found in a comprehensive market analysis. So the study that I was referring to from 2007, that data set came from a multi-county housing analysis that was done. So Lebanon County has never had a Lebanon County exclusive comprehensive market analysis of the housing market.
And what is what Jeannie Arnold did through United Way? What was that?
The 2017 Community Health Needs Assessment. Yeah, that was
that's
just
different too.
Very different. Yeah.
Basically,
So, but these are great questions. So this is, I handed out a copy of the request for interest that was sent to vendors, but I also brought for you, now this is from 2013, but when Lancaster County did their comprehensive market analysis, this is the first 13 pages of their 800-page report. And so this is a summary of what they found in the Lancaster County 2013, just to give you an idea of the type of data that comes out of a comprehensive market analysis.
That was along the question I was going to raise. Bear with me as the new guy.
Sure.
I am familiar with the county's comprehensive plan. I've read over that, and I think it's very solid. It still applies, even though it's from 2007. But help me understand. I mean, I'd certainly be curious to see a market study for Lebanon County. But what do you expect would be the overall cost to do that, and what would be the real practical applications? Is this really to focus on, do we have adequate low-income housing, and really in a nutshell? Yeah,
in a nutshell, I have a beautiful graphic that describes this, but that's okay. I will send you guys the presentation. Yes, your question is, I would guess, my best guess is that it's going to cost around $50,000 to do a study. I think it will take approximately 6 months to 10 months to accomplish. The vendors that do that type of study do use all of the most current data available. So they don't do, it's not a primary, some of it is a primary study, meaning they actually go out to the municipalities and would work on getting municipality individual data. That's why I think the city is very interested in this study also. But they also use a lot of secondary data. So like I mentioned, some of that secondary data is brand new. We do have the 2020 census data now available to us that would really increase the value of such a study. So things that would be included would be current economic conditions. You would be looking at the rental housing market. You would be looking at a trend and needs analysis of housing, so where those trends are coming. We know from our the transportation plan, we're looking at how many people are living here, working elsewhere, or living elsewhere, working here. All of those things impact our housing market. We would look at the home ownership market. We would look at housing with supportive services. So that's like something that doesn't necessarily get drilled down to when you have a multi-county study or a state study. And then, of course, a gaps analysis and a barriers analysis, and then provide recommendations.
May I ask one more question on studies? What is the difference between the hospital studies that have been done over the years and this study?
the community health needs assessments. The community health needs assessments are really a picture of the overall health of your county's residents, meaning we're looking for data around health outcomes. So how many people in the county have heart disease? How many people have diabetes? That's the traditional community health needs assessment. Would look, again, at sort of health outcomes. Newer community health needs assessments do investigate some wraparound services like social determinants of health. How many people in the county are food insecure? How many people have transportation barriers? The type of needs analysis that the Community Health Council is doing right now, we aim to just take it one step further than even the hospital does with some social determinants of health, saying, you know, we know from WellSpan's community health needs assessment that you have issues with transportation. But what are those issues? Is it that you can't afford the bus? Is it that the bus route doesn't go where you need it to go? Is it that you can't afford car insurance? Do you share a car with your husband? So these are like very broad community health needs assessments that really, in our Community Health Council needs assessment, we asked 3 questions on housing. It was, are you a renter or do you own a home? It was, are you satisfied, you know, with your housing? And then also, like, do you have any housing related needs, which could extend to you have inadequate plumbing, your rent's too high, you don't feel safe in your neighborhood, which are of course things that this study really, this is a pretty hard and fast, what does the housing market look like? And how can we, as a homeless coalition, and maybe this is a good opportunity for Brian to jump in a little bit on how the homeless coalition might use this data, but you know, really how can we convince the county or the municipalities to bring more affordable housing, or what creative ideas do we have around solving our homeless or our housing crisis, that we really are in quite a bit of a housing crisis crunch.
Michael, I have a comment if you would mind.
Yes, Bob, go ahead.
I think it's vital that this be done. It's been delayed, you know, for various reasons. I do agree with Commissioner Litz. If there's money from, you know, state or federal ARPA directly, that we would have to take it out of our ARPA funds. But I also consider affordable housing money as another alternative as well. But I think the question of whether we need it or not is not, you know, very hard to, you know, come up with the conclusion that we do. And, you know, so this will take care of our inventory across the county, and we'll know, you know, what we need more of and less of, and so on. It's really a very comprehensive and deep look at all those things. It's going to take 10 months, so it was, we can start.
Anybody get that?
Yeah, I did.
Yeah, I think, Joan, to your point, there's all of these different assessments that are out there.
Yeah,
There's health, there's the United Way needs assessment. They all kind of doing their own thing at a very superficial or high level, and nothing gets down to the macro level to say, give me something that I can do with it. So for an example, in a United Way needs assessment, we might find that the highest request out of the 211 call system was for housing. What does that mean? Is that housing like, hey, I can't pay my rent? Is it housing like I don't have a home? Is it housing like I can't find affordable housing? What's inside of that bucket? And for us from a homeless coalition side, when we sit around and we say, okay, what are we doing, right? We know we've got this homeless population. We know we've got family homeless population. We have all these different things. We want to get to the root of, for example, in our homeless shelter at LCCM, we couldn't move guests out of our shelter into housing because we couldn't get housing. So that becomes a housing stock issue. But I can't sit here and say to you, oh, there's a housing stock issue. I feel it.
We can't quantify.
But I can't quantify it for you. I can tell you that HDC has their Lakeview apartment complex that the wait list is closed. I can tell you that their HDC unit out in Fredericksburg filled up within, you know, a few weeks. We know that these housing developments, we know that also there's private assessments that have been done like this, but they're private, right? So I'm a developer, I do my own, but I'm not releasing that. The one significant advantage to this is the county planning, city planning, the different municipalities needing planning, the housing authority, the redevelopment authority, the homeless. If we do this through this process of collaboration on a coalition and homelessness community health council nonprofit funded by a couple partners. This now becomes a public document that we're able to share widely and put out there, and has pertinent information for us to say, hey, you know, we're already behind the 8 ball on affordable housing. We're already behind the 8 ball on just housing stock. If you take some of these documents, you could probably, based upon our opinions, cross off the dates and put today's date on it, right? Cornwall 11 School District is growing in housing. Palmyra School District is growing in housing. That hasn't changed in the last 7 to 10 years. But what's the impact on everybody? What's the impact on student ratios? What's the impact on affordability? You know, I think many of us are in a position now, we can't even afford our own homes if we had to buy them again. But that's anecdotal. Like, this would at least be able to give us some true tangible stuff to say, here it is now. We put it into a rubric and say, what are we doing to address it?
Yeah, I guess, you know, I would think that because Community Homes of Lebanon Valley is constantly putting in new sites, the Housing and Redevelopment Authority is, again, putting in new places there in Cleona, Care and Cupboard, that's what I'm trying to say. Up in Palmyra is doing a food bank in combination with low-income housing. I just happened to be looking at all of our low-income housing on a chart the other day. I bet you we are approaching 1,000 low-income rental units in Lebanon County. That's phenomenal to me. And there's a lot of government assistance to those as well. And so I think cities and boroughs like Palmyra and Myerstown are struggling with rentals. They're looking for homeowners. So are you looking for a program that would put people into getting to home ownership? Or
You know, ironic, we talked about home ownership a lot, and I say it because, you know, you say, hey, there's this number of units, that's impressive to me. Well, maybe,
Yeah.
or maybe not. Like, maybe that's only, you know, an eighth of what we need, or a tenth of what we need to have supportive housing. We talked about, we put it in the needs assessment for the community health, or community needs assessment through the health council. The question was, do you own or rent? But the follow-up question was, do you want to own? Right? We may say there's a lot of benefits in owning a home, but do the consumers, do the residents in Lebanon County want to own a home? We've talked to a couple of younger folks and said, hey, you know, why don't you own? Well, I just don't want to be tied down to that. So we need to kind of get deep into some of that stuff to say, maybe home ownership isn't where it's going to be. What does, you know, like we talked to Mayor Capella, and, you know, and Sherry said, like, I'd like to have a higher end rental housing unit in downtown Lebanon to generate energy, you know, but we would need to fill that, right? So, I don't know this, I'm sorry, one more thing. I don't know that the idea behind this is that it comes out and says, here's what you're going to do. It's going to say, here's your good, here's your bad, and here's your ugly. Now, what are you going to do about it as, you know, community stakeholders?
The one thing I wanted to mention is we do have support. I have talked to Julie Cheney. She is supportive of the study. We have talked to Brian Hoffman. Susan Eberly, of course, is very supportive of the study. We've talked to the Area Agency on Aging is very supportive. Like, senior housing it could potentially become an even bigger, broader issue than it is right now here in the county. I think people like Charlie Rush would be very interested in this study. There are a lot of applications for it. The fact that we can't say exactly how many affordable housing units this county has is part of the problem. One of the issues that we have as a nonprofit or a coalition is that we're really unable to write grants because we don't have the data. We don't have any current data to tell HUD, whomever, I mean, you name it out there. There's a lot of money circulating out there, and we can't write for it because we don't have accurate data.
You just kind of looking at your information you presented, it's titled Request for Interest. So
right.
The question is basically what is it you would like from the commissioners? Time frame?
Yeah. Great question. So, like I mentioned, I do expect the study to cost around $50,000. It could be less expensive. It could be slightly more expensive. The city, I do believe, is willing to support it in some way. I know based on conversations I recently had with their ARPA requests, they were over requested in their $1 million. So I'm not sure I will get the entire. I asked them for $30,000. I don't think I'm going to get $30,000, but I am going to get something from them. So I am asking to see if the county would cover the rest of it. And the project, we could manage the project as the Coalition to End Homelessness would be project managers. Once I do have funding or a promise of funding, we would then work on the request for proposal, which would include all of the stakeholders who are interested in this data. I don't want to leave anybody out. So the Health Council, the Coalition to End Homelessness would convene a group to finalize the request for proposal and then send that out. And then, of course, the commissioners, the city, whoever is funding the study would have final approval on the vendor that's chosen to do the study.
And are you applying for these funds like, I don't know if Congressman Mooser sent it out, but the state legislators send it out? There's a grant application due right now. Are you applying for that money?
I did not see that was relevant to this particular project. It really feels like a good fit for ARPA or Act 137.
I think it is ARPA money.
Yeah.
But they're doing it as special.
Those are casino funds from.
Casino
from
funds.
Representative Ryan and Diamond sent that out.
Yeah, that's the one.
Yeah, those aren't ARPA funds.
I thought they were, not, okay,
No, it's casino proceeds. That's Lebanon County share of it.
okay.
So in the interest of time, I think, Bob, speak up and correct me, but I think I heard clearly Commissioner Phillips feels this is a critical need and is interested. Commissioner Litz, do you agree, or?
I need to read I
Sure.
just, this is talk. I need to see
Absolutely.
facts
Yeah.
and
Yeah, my
I need to
reaction-
read things on my
This
own
is the same,
and then
is
I can
that-
absorb it, yeah.
But I also look at it, this is an investment. You can look at it as a cost, a $50,000 cost, but an investment too, because if we can identify those needs, there may be grant money that we can apply for.
Absolutely. And I know that county planning would use the study to revise the next comprehensive plan. This would become the basis of that housing portion of the comprehensive plan.
And just looking around, not even being an expert, but my wife being a real estate agent, the cost of all housing has skyrocketed in the last few years. And so clearly, affordable housing just keeps going up and getting farther and farther out of reach for more people.
Yeah, at the end of the day, I think take home is Julie's gonna need it, the city's gonna need it, the municipalities are gonna need it, everybody's gonna need it, and we hate to see any municipality or anybody going out and trying to do this on their own when we can just do one collaboratively, and then we make it a public document funded through 137 or ARPA, and we just put it out there. It just makes sense for there to be one study done that we all use and share. So.
Well, I think it's safe to say that you have our interest, and we'll see how.
So I'm not sure what the next step.
The second part of Commissioner Kuhn's question was the timing. When do you expect to hear from the city?
Good question. I think they were looking to make their final judgments or their final disbursements by the end of this month, the middle of April.
Okay, so I think there sounds like there's interest here. I think the question is then how much. So, which you won't know until you know what the city's
I won't
giving.
know exactly, right.
So I think I think the next step is to wait and see what you're gonna get out of that, and then you'll have a number.
Okay.
Does that make sense?
Yes, it does.
I do have a more thorough draft version of a proposal, which I'm happy to send you guys. But
it
it's
is a
draft. that's I'm nervous about handing out because I don't want people to think that.
I just need to read
Sure.
things for myself, so, sometimes people can interpret things differently, what they hear. And my hearing's not the best, so I like to read everything.
Sure.
I would appreciate
absolutely.
it.
Yeah.
Bob, do you have anything to add or any questions?
No, let's keep it moving.
Okay.
Okay. Sounds good. All right,
Thank
guys.
you.
Thank you
Thank
very
you.
much.